Hi, and welcome to the How to Survive Healthcare podcast. I'm your host, Kayla Thompson-Riviere, seasoned critical care RN turned independent patient advocate. Tune in every week so that you can learn the things about the U.S. healthcare system that no one ever tells you. That way that you can get the most from it and optimize your health outcomes. Now, of course, this podcast is strictly to inform and entertain and should never be taken as a substitute for medical advice. Let's dive right in. I wanted to talk to you about CPR and about kind of the realities around CPR that I don't think get talked about enough. So I think we've all seen on TV where somebody has a heart attack and somebody rushes in and does CPR, and they do a few pumps on their chest, and that person springs back to life, and everybody's super excited, and it's a great happy ending. Unfortunately, that is not a very typical scenario at all, and I think that does set us up for really a lot of negative experience when that's the only representation we've seen, and so therefore that ends up being people's expectation of what CPR is like and how powerful it is and what it can do. So I want to clear up some of that today, and I want to start off by saying that according to the American Heart Association, only about 10% of people who have a cardiac arrest outside of the hospital actually survive through the hospitalization. So it is not as typical as certainly as TV makes it seem. Now, CPR plays a very critical role in that. It's estimated that when CPR is started early by bystanders, you can actually double, sometimes triple, a person's chances of survival. So CPR plays a very important role. However, I do want to specifically distinguish. CPR cannot cure a person and is not the piece that indicates really whether or not they're going to survive. So that may sound very confusing. Let's talk about what CPR actually is and what it does. So CPR stands for cardiopulmonary resuscitation. It's administered in the event that somebody has stopped breathing and their heart has stopped beating. That's what's known as a cardiac arrest. CPR is made up of a few basic components. The one you're probably most familiar with is chest compressions, where you see a person beating on the victim's chest. It's done in a very specific way and a very specific rate, and the whole purpose of it is to mimic the action of the heart beating. Your heart is just a pump. So when a cardiac arrest occurs, the pump is not pumping. So there's no blood flowing around the body. There's no oxygen coming into the body and carbon dioxide and waste products going out. So the pumping mechanism on the victim's chest helps to mimic that, what would naturally be occurring, so that as the heart is in that stopped state, you don't have immediate widespread death of all of the cells, tissues, and organs in the body. The next piece of CPR is ventilation. So you may have heard of mouth-to-mouth breathing. Again, the chest pumping is mimicking the blood circulating around the body, but the number one thing that all the tissues need is oxygen. So mouth to mouth provides some oxygen into the lungs, so then it can be exchanged with that blood that we're circulating by chest compressions. And then once you can get 911 on the scene or get the patient to the hospital, they can actually insert a tube into the patient's lungs and be able to hook them directly to a bag to give oxygen, or a mechanical ventilator, so we can replace that piece of what the lungs should be doing, getting air in and out. The third piece of successful cardiopulmonary resuscitation, or CPR, is medications. The majority of the time, the chest compressions and air alone is not enough to get the heart to wake back up and restart again, it does take medications. Now, of course, this is something that nobody is going to be able to do as a bystander. This is going to be require paramedic assistance and or continued assistance at the hospital in the emergency room. So those are the three pieces of CPR. So as you may be able to deduce from that, CPR, all it's really doing is trying to replace the normal functions of the heart and lungs so that tissues and organs aren't dying while those things are stopped. And then the medications help to try to get the heart restarted again. But the biggest piece that is missing, or that CPR can't do, is fix why the cardiac arrest started in the first place. And that's the biggest indicator too of survivability. So when CPR was first discovered and started being trained and implemented, it was actually only meant to be used in very specific cases where there was some sort of issue, some reversible cause of the cardiac arrest. For instance, CPR does, and resuscitative measures do tend to be quite effective for drowning victims. A person who was perfectly healthy before they fell in that water, that they have a healthy set of heart, lungs, and other organs, that when we can reverse that issue of the drowning, we can get everything to come back online. CPR was never intended for the person with a terminally ill condition or multiple organ failure, because what caused the cardiac arrest in the first place? The CPR will almost never be able to undo the cause of the cardiac arrest. It's only, again, sort of buying time and mimicking those actions to keep the patient from death long enough that the healthcare team can treat a reversible cause. There's a whole list of reversible causes. Poisoning can come into effect, temperature, whether it be too high or too low body temperature, injuries, blood loss, all sorts of things. But that's the biggest limitation of CPR, is it's probably not appropriate for everybody. So this is, and what's interesting about that is that this is the only medical procedure that is automatically, at least in America, is automatically applied to everybody unless you opt out in advance with like a do-not-resuscitate order. So not appropriate for everybody, but automatically applied to everybody, because we practice medicine under this philosophy of we have to do everything. And that makes sense, right? I mean, if somebody truly, their wishes were that they wanted every possible thing tried before death occurred, when somebody's heart has stopped, we can't have the conversation at that time. So the medical personnel is going to do what they can to try to bring that patient back until such a time that, the family has a discussion that that's not really what the patient wants, or if it has reached a point of what's called medical futility. There's different definitions of that, but resuscitative efforts will be stopped after a certain amount of time. It varies depending on the situation, all the factors involved. It's not a short amount of time. Often it's, if it's been more than 60 minutes from the time that the person went into a cardiac arrest, that's typically the window that we're looking at for when resuscitative measures are stopped. And that's simply because even if somehow you were able to get the heart to come back online at that point, there's just way too much organ damage that has been done. You can start have brain cell death within 3 minutes of cardiac arrest or of a respiratory arrest, because really it's the oxygen flow that's the issue. And although CPR, all those actions, as I said, mimic what's normally happening with the heart and lungs, that's all they do. They mimic it. It is by no means the same. So there's a lot of factors to consider, and that's why even people who we can get them resuscitated and get them out of a cardiac arrest still doesn't mean that they're ultimately going to survive the event, because you're asking the human body to sort of try to be in suspended animation for however long that took, and it just doesn't work that way. All the cell processes are still trying to go, and everything, when there's a buildup of different toxins and not enough oxygen, death and damage starts very quickly. So that is why resuscitation measures will be stopped after a certain amount of time, whether that's the wishes of the family or not. It just reaches a point of medical futility. So I also want to mention that CPR, not only is it more limited than what you see on TV, it is far more brutal than what you see on TV. I remember learning in nursing school that it was very shocking at that time, but if CPR is done effectively, you will break ribs, multiple ribs, and very quickly too, especially as we are talking about our elderly population. The patients that I have had survive a cardiac arrest and then have taken care of in ICU, it is incredible to see like their internal scans and like x-rays and CAT scans afterwards, and the amount of internal damage that gets suffered from having your rib cage crushed on, all in the effort of trying to get them back. It's very common also to puncture lungs, or sometimes have some injury to the heart muscle itself, just again in that attempt to stave off death. So it's not a procedure that comes without risks, or it's very, very painful for a person who is lucky enough to survive it. So when you take into consideration that it is incredibly brutal, hard on the body, creates a lot of injury from somebody who does survive the event, and also can't fix the problem that caused the cardiac arrest in the first place, it starts to make sense then why CPR is really, for a lot of people, isn't a great option. And this is why a lot of times if you do have a family member who's been, maybe has been in intensive care for a long time and isn't getting better, or a lot of people are familiar with this around a cancer diagnosis or any other terminal condition, this is why the discussion of do not resuscitate orders gets brought up. Because again, if the patient has a terminal condition, there's something wrong, whether it be a cancer or an organ failure or a very traumatic accident, and there's just too much for their body to recover from, that's what terminal means, then we have to stop and ask ourselves if putting that, when the time comes and the person does ultimately decline to the point where their heart is no longer even able to continue beating because of this condition that they're in, is it the right choice by the patient to then put them through these resuscitative measures when we know that even if we can get them out of that cardiac arrest, we still can't fix what landed them there in the first place, and it will happen again. So this is why your doctors will bring up discussing should the patient have a DNR or a do not resuscitate order. A lot of people hold the feeling that if it's their time, that they would want death to naturally take its course. However, if that's not put into a do not resuscitate order and paired with an appropriate medical power of attorney who is going to respect those wishes and maintain the wishes of the patient, they may not get those wishes and they may end up with a very brutal exit. And I've seen it happen so many times. This is a conversation, the conversation about medical futility and whether resuscitative measures are appropriate for a person or not is a conversation that's not had enough. In my opinion, it should be had between the physician and the patient and their medical power of attorney whenever somebody has received any kind of terminal diagnosis, or if they have a multitude of medical problems going on and their perhaps, their primary care physician is concerned that, we may be nearing the end of natural life. It would save a lot of people a lot of heartache, and as I've discussed in previous videos, death is inevitable. At some point in time, for me, for you, for everyone that we love, our body is going to face something that it can no longer overcome. And that issue, illness, ailment, injury will overcome us. So knowing that there is some inevitability to that, we have to really decide how we want our death to be. Do we want it to, accept that terminal diagnosis and, have some peace around our death? Or is it a value that, you want to try every last thing and, no hold bar on death? And that's a very personal decision. There's not a right or a wrong to that by any means. But it just, as I mentioned before, resuscitative efforts are the default. So, and it's not going to be helpful for everybody. So that's why it's just so important to inform yourself of what a resuscitative effort really entails, the power that it has or doesn't have, and then start to have discussions between your healthcare providers and whoever helps you with your medical decisions and who will be your medical power of attorney, and just start to kind of figure out what is right for you. If you don't think resuscitative measures would be a good choice for you, then you need to get that in writing and with a do not resuscitate order from your doctor, and make sure that your medical power of attorney is prepared to enforce that order so that you can have your peaceful, dignified death that you wish for. So that's one of the biggest takeaways from today, is just please have that conversation. See if it's appropriate for you. Obviously, there are plenty of places where it is appropriate. That is not my concern. I see so much, though, where it is applied inappropriately. And as a healthcare provider, we get very stuck in a position that, like, we, again, in this country, not all countries operate this way, but here in the U.S., we are not in a position where we can say, I just don't think we should resuscitate this person because it's going to do them more harm than good. We don't have the authority to make that decision. We have to continue to try until we reach a point of medical futility during that effort, or a family member says enough is enough, a decision maker. So please have that conversation ahead of time. If your family decides CPR is a good choice. Like, for instance, I'll take myself for example. I am fortunate that I am blessed with both a young age and good health. If something suddenly happened to me, I was in a car accident or something, I was in perfectly good health before that. I am a very good candidate to survive a traumatic cardiac arrest. I would absolutely want resuscitative measures to be done. So when you do have people around you who resuscitation makes sense for, also do yourself the favor, consider taking a CPR class. You can usually find them for free at, like, the fire halls often will do them somewhere around you, or other areas in the community. Especially if you have little children. I mean, kids do some of the craziest things, whether it be, choking on a blueberry, or getting into a box of medicines, falling into a pool. It's just really good to have some basic skills on hand, because as I mentioned, early bystander CPR, meaning before 911 gets there, can double or triple a person's chance of survival if their cardiac arrest was caused by something reversible and they're a good candidate. So arming yourself with the knowledge of how you can help your family is my second biggest takeaway for today. So I hope that this was helpful for you. I don't want to sound totally grim, but it's something that I see a lot, and I'm very passionate about, because I think people need to be informed of their choices before those choices are made for them. So let me know if this was helpful for you and what kind of videos you would like to see in the future. And I look forward to talking to you again next week.